Elderberries are glossy, tart, deep purple fruits of the sambucus tree. Among many varieties, the most common one is the European elder or black elderberry, Sambucus niger. Native to Europe, black elderberry grows across America, Asia, and northern Africa now. The tree is up to 30 feet tall, with brownish grey bark and fragrant white flowers. The fruits are small, dark-coloured berries, sometimes appearing almost black. Elderberry can help to fight a cold and flu. It kills viruses and bacteria. Its great nutritional value. It relieves gum inflammation, and it can protect the skin and the heart. All parts of the black elderberry are used in folk medicine. The flowers and the leaves are natural remedies for reducing pain, swelling, and inflammation. Preparations from the bark are taken to stimulate urination and bowel movements. Fresh or dried berries are thought to relieve headaches, toothaches, lower back pain, respiratory infections, as well as constipation. Recent research voices the traditional wisdom. Flavonoids discovered in the flowers and the fruit of the elderberry tree have antiviral, anti-inflammatory, and antioxidant properties. People use it to combat flu, respiratory infections, and more. Furthermore, Sambucus niger has become popular in the food industry. The berries are often used to make refreshing, sweet, tart juices, jams, jellies, pies, punches, and wine. The flowers are boiled to prepare a soothing, creamy tea or a syrup, or added to batter when baking. Elderberry supplements like syrups, lozenges, capsules, tea, and powder are all typically made from the European black elderberry, or Sambucus niger. All elderberries are rich in anthocyanins, powerful antioxidants responsible for the red, blue, and the purple berry color. Although both European and American elderberry abound in antioxidants, the European variety is higher in specific ones, the phenolics and the flavonoids. Anthocyanins deepen the color of the plant, which explain the greater potency of the black elderberry, especially compared to the red variety. Red and blue elderberry, native to the North American continent, can offer distinct health benefits. Native people would collect the berries in the summer and store them in a safe place for medicinal use during the winter months. Black elderberry is rich in bioactive components, the most important ones being the flavonoids like rutin, quercetin, and anthocyanins, which have antioxidant, anti-inflammatory, and antiviral properties, and pro-vitamin A, carotenoids, and vitamin C. Elderberries are a low-calorie fruit, high in nutrients and antioxidants. Their precise nutritional content depends on the ripeness of the fruit, environmental conditions, and the plant variety. 100 grams of fresh elderberries typically contains only 73 calories and will provide 28% of your daily fiber requirement. The fruits are rich in vitamins like vitamin C and provitamin A, and minerals including iron, potassium, and phosphorus. The leaves, berries, and the flowers are high in antioxidants, flavonoids, phenolics, and anthocyanins, and these lower oxidative stress and they balance the immune system. Elderberries have the highest amount of flavonoids compared to 28 different species of berries. Sambucol is a popular, widely available brand of standardized elderberry extract. In clinical studies with over 80 people with influenza A or B, taking Sambucol syrup for 5 days relieved the symptoms 4 days faster than the placebo. Elderberry lozenges 4 times a day reduce fever, headaches, muscle pain, and nasal congestion within 48 hours in a clinical trial on 64 people with the flu. Elderberry syrup also decreased the duration of flu-like symptoms in chimpanzees. Flavonoids in elderberry can prevent infection from influenza A and B virus, which are responsible for the yearly seasonal flu epidemics. In test tubes, elderberry could bind to both viruses and prevent them from entering the cells and multiplying. Symptoms of the flu and the cold often overlap, but colds are caused by different viruses and they're usually milder. Frequent travellers are under stress. Long flights and layovers put a strain on the immune system and the respiratory system. In one clinical study of 312 people travelling overseas from Australia, elderberry extract reduced the severity and the duration of common cold symptoms when compared to the placebo. Non-steroidal anti-inflammatory drugs are common ingredients in cold and flu products, such as Advil. They reduce the symptoms such as swelling, pain, and stiffness. A combination of elderberry and other herbs, gentian root, cowslip flowers, sorrel, and vervainwort, might work in a similar way. It lowered the inflammatory enzyme COX-2 and messengers PGE2 in rats. In clinical studies with over 2,300 people with bacterial sinus infection, a combination of elderberry and other herbs, the gentian root, cowslip flowers, sorrel, and the vervainwort, reduced inflammation, headaches, and nasal discharge. In test tubes, elderberry extracts blocked the growth of bacteria that cause malaria and a myriad of other health problems, including Plasmodium falciparum, Streptococcus, E. coli, Staphylococcus, Bacillus, Salmonella, and Helicobacter pylori. It was also active against herpes simplex virus, which causes cold sores. In several clinical studies with more than 200 people, a herbal mouth rinse containing elderberry and echinacea decreased gum inflammation or gingivitis, bleeding, and plaque size. In a clinical study of 20 people with constipation, a tea containing elderberry, anise, fennel, and Alexandrian senna increased the number of evacuations per day, and it improved bowel movements. It's unclear to what extent the elderberry helped, since senna is a well-known laxative. Flowers and berry extracts, together with asparagus, reduced body weight and improved blood pressure and quality of life in a clinical study on 80 people. In another study on 34 healthy people, elderberry juice for 2 weeks slightly decreased cholesterol levels by 9 mg per deciliter and oxidative stress when compared to the placebo. In animals, elderberry extracts lowered blood pressure, liver cholesterol, blood triglycerides, and fat buildup, all of which increased the risk of heart disease. They also increased glutathione, one of the most important antioxidant enzymes in the body. However, elderberry extract had no effect on inflammatory biomarkers, blood fat or sugar levels in a clinical study on 52 healthy postmenopausal women who were given it for over 12 weeks. Elderberry may protect the heart by reducing blood pressure and cholesterol. Elderberry is rich in flavonoids, phenolics, and vitamin C, and provitamin A. These decrease oxidative stress, prevent skin damage, improve skin elasticity, and lessen wrinkles. A formula containing elderberry, common hawthorn, and dwarf everlast had a sun protection factor of almost 10, meaning that these herbs can naturally protect from UV rays. Elderberry extracts act as an immunomodulator. It can calm an overactive immune system or activate an overly suppressed one. In studies on human cells, elderberry syrup increased the production of inflammatory cytokines, which are needed to activate immune cells. Elderberry syrup also increased the anti-inflammatory cytokine interleukin-10, which might help to restrict the immune response and prevent it from getting out of hand. Elderberry extracts stimulated the production of white blood cells, the T helper cells, and the macrophages, which increase the overall immune defense. Elderberry and elderflower extracts may balance an overactive immune system by blocking nitric oxide production in the cells. Overproduction of nitric oxide has been linked to inflammatory autoimmune disease. Elderberry may balance the immune system, but clinical studies are lacking to draw conclusions about this. Elderberry extracts prevented insulin spikes and insulin resistance in mice who were fed a high-fat diet. Based on test tube experiments, it might work by promoting insulin production, by transferring sugar from the blood into the cells and the tissues, by breaking down sugar in the cells, and blocking enzymes that digest carbohydrates, which can help to lower blood sugar spikes after meals. According to limited animal studies, the elderberry may help to improve irritable bowel disease symptoms, reduce ulcer-causing Helicobacter pylori infections, and boost mood and fight depression. When used in adequate amounts, elderberry tea, extracts, and other products are generally safe and well tolerated. However, there are important precautions to consider when it comes to this herb. The bark, the leaves, the root, as well as the raw and the unripe berry contain a toxic compound. This can lead to cyanide poisoning. Consumption of raw elderberry products can cause nausea, vomiting, diarrhea, and even lead to hospitalization. In 1984, 8 people became sick after drinking the juice from fresh berries, leaves, and branches of the Sambucus mexicana tree. They suffered from nausea, vomiting, weakness, dizziness, stomach pain, numbness, and impaired consciousness. The level of the toxic compounds in raw berries is not extremely high, but it can still cause serious health problems. Cooked berries and standardized extracts are safe to consume. Fresh elderberries contain lectins, and these can also cause a reaction in sensitive people. Cooking the berries, again, reduces the lectin content. Some people are allergic to elderberries, and they can experience typical symptoms like a runny nose, itchy or red eyes, and difficulty breathing. However, elderberry allergy affects only 0.6% of the general population, according to a study on over 3,500 randomly tested people. Pregnant and breastfeeding women should avoid elderberry supplements due to the lack of safety data. Based on its possible benefits, elderberry, in theory, may interact with certain drugs, like laxatives, diabetic medication, blood pressure lowering drugs, and immunosuppressants. To make a syrup, add 3½ cups of water, 2/3 of a cup of dried elderberries, or 1 1/3 cup of fresh or frozen, and 1 cup of raw honey or brown rice syrup. For a flu or a cold, 15 minutes of elderberry syrup, Sambucol, 4 times a day for 5 days is recommended. Alternatively, take 175 mg elderberry lozenge 4 times a day for 2 days. Since various formulas exist, it's best to follow the instructions on the label. For bacterial sinus infections, 2 tablets of a multi-ingredient herbal product called Sinuprept, which has elderberry flowers, gentian root, verbena, cowslip, and sorrel, 3 times a day for up to 2 weeks. For lowering blood fats, 400 mg of elderberry powder, or 5 ml of elderberry juice containing a 10% anthocyanin content, 3 times a day for at least 2 weeks. And for gum inflammation, 15 ml of the multi-herbal rinse containing elderberry, centella, and echinacea for 60 seconds twice a day. Clinical studies support the traditional use of black elderberry for reducing flu and cold symptoms, other infections, and gum inflammation. It can also protect the heart and the skin. Standardized extracts and cooked berries are safe for the general population. Children, pregnant and breastfeeding women, or people taking medications should consult a doctor before use. The stems, the bark, the leaves, and the raw berries can be toxic. For more information about herbs, supplements, and natural treatments, check out my website.